Pearls that I learned from my palliative care rotation. Number one, you should never say to a patient that there's nothing more that we can do for them. There's always something more that we can do for the patient, whether that be changing the focus of their treatment goals to making a child's wedding, comfort-focused care, or helping them enjoy something that's important to them. No matter what stage a patient is at, there's always something we can do for them. Number two, as primary teams, we should really be doing goals of care discussions and post forms by ourselves before getting palliative care involved. If needed, we can always enlist the help of social work to fill out things like advanced directives and designated power of attorneys. Number three, there are several good approaches to holding difficult conversations, among them including the Spikes mnemonic that you probably learned about, as well as the Serious Illness Conversation Guide. Both of these tools basically provide a framework which really revolves around A, establishing how much the patient or their family understands the disease, 2, how much information they would like, and 3, what are kind of things that are important to them and what are goals for them moving forward. Number 4, we should be very honest that we are not very great at estimating how long a patient has left to live. When we do give estimates, we should use time frames such as days to weeks or weeks to months instead of giving a definitive time. Number 5, we should provide anticipatory guidance for patients who are nearing end of life with a terminal illness. Things like letting the patient and the family know that decreased appetite is expected towards the end of life and that not feeding the patient is not going to hasten their death. That as they get closer to death, they will have more irregular respirations, but that's not necessarily a sign of discomfort. They may become more pale and their extremities may get cooler over time. And really, when we're focusing on treating their pain and anxiety, it's really going to be based off signs like furrowing their eyebrows or tensing up their body. And those are markers of when we're going to treat. And pearl number 6, we should ask patients if they're spiritual so we can get a chaplain involved early, which can really improve their care. And we can also consider adding a musician therapist to their care as well.